The mysterious vaping illness has sickened 200 people and has now claimed 2 lives. We have Dr. Dixie Harris, a pulmonologist at Intermountain Healthcare, to explain this very serious and scary situation that's been going on. It's sickened people here in Utah and across the country, and we're learning of that second death in Oregon that just happened.
Yes, this is a very serious issue. What we're seeing is ongoing cases. Almost all the cases have been vaping some sort of THC oil. Other cases are doing e-cigarettes. Many of the cases are doing combined. We still don't have one specific item that we know is the actual cause at this point.
And in the pipeline, of course, you hear so much information because people are just grasping to find out what it could be. I'm already hearing vitamin E could be it. We talked yesterday about THC could also be in the mix as well.
So the Washington Post, I believe it was in the last 24 hours, reported that vitamin E is being a suspect, and that would actually be part of what the mixing is in the diluent in the THC. We're not exactly sure what's happening in the supply chain. Remember that THC is not legal here in Utah, so it's being obtained in other states, and that's what all our healthcare providers and investigators, between toxicologists, epidemiologists, everybody in our state is trying to figure out what's coming into the state, what's happening to what's coming into the state.
And could there be multiple causes is what I'm hearing. We were just looking, Dr. Harris, on these x-rays. Could you describe what is happening, if we don't know what chemical or what's happening, but what is going on in the lungs if we can see it clearly?
Yeah, so when you're looking at the chest x-ray, you can see patchy clouds all the way in both lungs. And what we do know, when you vape, whatever you're vaping, it goes deep in the lungs, very deep, down past the bronchi, bronchioli, and down into the air sacs or the alveoli.
Because everything we're inhaling has to go somewhere. I mean, we may see puffs of smoke coming out,
correct,
but it is going through and funneling into our lungs.
Going all the way deep in the lungs, as deep as it can go in the air sacs. And then it's stimulating inflammation, and that's when we do our testing of the lungs. We see all kinds of inflammatory cells have been activated.
And is this damage that's permanent?
That's a very good question, because in just the last 24, 48 hours, I've been having an opportunity to see our patients in follow-up. And as of now, several patients we've seen as far as all the ICU pulmonary doctors. And at this point, no patient has completely normal lungs.
Wow.
A little evidence of damage. Most of them are doing very well. They're back to their usual activities, but you have to consider a 20-year-old should have supernormal lungs. So right, we do see evidence of damage.
And we do know that a lot of times when there is pollution, say, it's cumulative. So we do have to be careful what we're doing today will affect us down the road. We don't know. Tell us a little bit about the numbers. They keep coming in. They're pretty dynamic. You're working with the health department as well.
Yes. So the first numbers that we reported to the health department's first week of August was 4. And 4 different hospitals, 4 cases. And as of now, for Intermountain Healthcare, we have reported 22 cases. I reported another case just today.
And then the health department reporting 28 cases and 14 suspected. So those numbers are climbing.
They're going up every week.
And we do need to let the public know, and some people are calling it an epidemic and a health crisis. So we will see as this continues. Thank you, Dr. Dixie Harris with Intermountain Healthcare. More to talk about as this goes on. Thank you so much.